minutes each. Just important to note is that this webinar is going to be live on Facebook, and the other participants will be joining us through that Facebook, and other participants will be joining us through Twitter. Important to note also as we start is that we are going to be having poll questions every after 30 minutes, or say every after the Singh quiz presentation and after the panelists. Where the poll questions will be appearing on the screen, and you can respond. Participants, you are requested to respond to those poll questions according to your opinion, according to what you see fit with the options. And the panelists, you are not able to vote or respond to the poll questions, but to be observers and monitor what is happening. Dear participants, we request you to join this webinar actively and participate actively. You have an opportunity to do so through the Q&A section, which you can see on your gadget, depending on what you are using. If you are using an iPad and a phone, it will be on the top. If you are using a laptop, you can see those icons at the bottom. So you should be able to give us your feedback, your questions. Please do not use the chat room. The chat room will not be open for you. So that's how we are going to run this webinar this morning, and you are most welcome. We are going to be starting, and we will start with an opening prayer. We are going to request Mr. Benan Wanyama to lead us in the opening prayer. Thank you so much, and you're most welcome. I'm Dr. Lawrence Mugisha, who is going to be your moderator this morning.
Thank you, Dr. Lawrence. Let's pray. Dear Lord, we want to thank you for this day. We want to thank you for this morning. We want to commit this webinar into your hands, that as we discuss and as we share, you'll give us the ability to form knowledge and opinions that will help us progress in this sector. We pray that you'll give us a good discussion, that you'll sustain our networks wherever we are, and that we shall have impact as a result of the discussion that we shall have here today. In Jesus' name we pray. Amen.
Okay, thank you so much, Bernard. Let me now take this opportunity to welcome Dr. James Magara to give us welcome remarks as we start this webinar. Dr. Magara, please, you are most welcome.
Thank you very much, Dr. Lawrence. On behalf of the Castle Board, I'd like to extend a very warm welcome to our guests this morning. First to our special guest, who will be formally introduced later on, and then all the panelists, and then the participants who are joining us in the Zoom room, and others who are joining us on Facebook and on Twitter. Welcome. Thank you for choosing to spend your morning in this conversation. Castle, from the beginning of the lockdown, decided to look for the silver lining in the cloud, the dark cloud called COVID. And in our membership, we held a multi-sectoral workshop that looked at opportunities in every sector. And then we wrote documents, and for the last 5 months or so, we've been having discussions on each of these different sectors every Saturday morning. We are coming to the close. This is, I think it's webinar like number 27, 26, 27. And we have a few more to go before we close. These are not just talking shops. We've written documents. We are really privileged to have an expert panel this morning that will weigh in on what we've written, critique it, bring in more ideas. In the early part of next year, we're doing a massive writing exercise that will make this information available to stakeholders, decision makers, and players in the different sectors. We thought as a think tank, that's a contribution we could make towards maximizing the opportunities that this pandemic has brought. There are challenges, but there are opportunities as well. So I'd like to once again warmly welcome you. And as we often say in these mornings, put on your thinking caps. We will challenge every idea. Let's think. Let's think. One of the challenges we've had sometimes is acting without much thinking. So we do hope that the ideas that come out of here will actually play a big part in helping us move forward, even in this sector or in this area that we are discussing this morning. So thank you very much once again, and back to the moderator.
Yeah, thank you so much, Dr. Magara, for that brilliant introduction. Once again, participants, you are most welcome to this webinar on WASH. WASH is water, sanitation, and hygiene. It is a very, very interesting area we are going to discuss, because when we say wash, you think it is immediately meaning to go and wash, but it has very, very important components of water, sanitation, and hygiene, as it is going to be discussed. As we are going to have this webinar this morning, we are privileged to have a special team with us this morning of special guests and panelists, and they will be introduced in full, but briefly. We are going to have our special guest, Ms. Julian Chomhand. You are most welcome. The Commissioner, Environmental Health Department, Ministry of Health, you are most welcome. Later on, we'll have more introduction. We are going to have 4 panelists with us this morning, very distinguished. The first one is Ms. Hajara Mukasa. You will be hearing her, and more details will be provided. Dr. David Musoque, Mr. Shiva Narian, Engineer Wilfred Okero. All of you, you are most welcome, and we are privileged to have you this morning to discuss this important component of water, sanitation, and hygiene. Just briefly, before we start, I just want us to remind you that we are facing COVID-19 pandemic that started late December 2019, and it has affected the entire world. As of this morning, over 61 million people have acquired this disease, and over almost 1.5 million people have died of this disease. In Uganda alone, we started well. The first case was documented in March, but now we are in a different wave. We've been talking about COVID waves, but in Uganda now we are in a different wave. We are almost close to 20,000 people who have gotten this virus, and almost 200 people have died of this COVID disease. So it is a very, very serious challenge, not only to us, but to the implementers, to the line ministries, and to everyone. So this morning, we are privileged to be sharing the webinar, COVID-19 Opportunities to Thrive. As Dr. Magara has mentioned, for us, we decided to look for the silver lining. And this morning, all panelists and our special guests will be sharing with us what is happening in this area of WASH. WASH was one of the major strategic areas that have been used for reducing or controlling the widespread of COVID-19 by instituting measures that help the public to help reduce the transmission rates. And that's why the public was requested to institute washing facilities in all public access places, even including our homes, that we should have washing facilities together with soap. Ordinary soap can do great wonders. But we also, if we have sanitizers, even much better, make sure all surfaces are being sanitized. So this morning we are going to be listening to what, since then, what has been happening, what can be done. Along the way, we have seen that even people have to be forced to wash, which should be a voluntary mechanism whereby everybody should wash. Importantly to note, as we start this webinar, is that wash is a public health measure to prevent so many other diseases, including waterborne diseases and other infectious diseases that can be transmitted through contacts and contamination of surfaces. So it is not only for the COVID, and probably that's what we need to hear, what has been happening before COVID, during COVID, and what is likely to happen after COVID. So with those few remarks, allow me once again to welcome you participants and remind you that you are most welcome to participate, and your participation is highly welcome. You can participate by posting your questions on Q&A. Depending on the gadget you are using, you can see on the top tab or the bottom of your gadget. You should be able to see those tabs, Q&A. Please don't post in the chat. It is Q&A that is open. Then we are going to be having poll questions every after the presentation. Please respond quickly. It appears only for a few seconds, almost 1 minute, and we close it. So you will give us your own opinion, your own answer, and we will be very grateful. Once again, is to remind you that this webinar is going to be live on Facebook and on Twitter if you go to Casho hashtag. With that, allow me to now invite our Think Peace presenter, Catherine, and I'm going to be introducing her in details. Miss Catherine Kasozi Opondo, she's going to be our Think Peace presenter, and allow me to welcome her and also introduce her before she can present the paper that has been very well prepared. Miss Catherine Kasozi Opondo is the Executive Director of Concern for the Girl Child, a non-governmental organization that started in 2000, for which she was a member of the Board of Directors on the Selection Committee for Beneficiaries of the organizational program. As a board member, Catherine supporting the organization early growth at the governance level for 10 years. She spearheaded a dual project promoting good governance and integrated community care in 4 districts, mainly Wakiso, Ruwero, na Kasongora. A role she assumed in 2014. She has worked tirelessly to enhance the visibility of the organization through results-based report approach. Together with the team, she has established impact of 4,000 modest number of children, 40,000 modest number of children, with 1,000 girls impacted and enabled to realize their potential within 20 years so far. Now, Catherine, she has been an active project director, and she is an active project director for Rotary Club of Mengo, advisor, Global Education Services, associate director, Foundation and Mentors Girls for Girls, and Catherine is married with 3 children, 2 daughters and 1 son. Catherine holds a Master's of Business Administration in Management and a Bachelor's of Business Administration Marketing and a Master's Certificate in Strategic Organizational Leadership. Allow me at this juncture to invite and welcome Catherine to present to us the paper that has been prepared by CASO and going to be presented by Catherine Opondo. Catherine Opondo, you are most welcome.
Thank you so much, Dr. Lawrence. Thank you for that wonderful introduction. And I'm privileged to be presenting the CASO think tank and WASH today. This morning, I would like to start by communicating that the COVID-19 pandemic has disrupted health systems globally. As countries instituted measures to shield themselves from this impact, water, sanitation, hygiene measures provided immediate universal strategies to curtail the spread of the virus. WASH, therefore, presents the most cost-effective strategy for preventing and protecting human health from many infectious diseases, including the COVID-19 outbreak. This pandemic has exposed gaps in the existing implementation of WASH services. COVID-19 prompted the Ministry of Health and other health agencies to reignite the WASH programs and activities in Uganda. Furthermore, the government called upon local industries to repurpose their production lines to include the production of sanitizers, wash equipment, and of course, massive production of soap. Water, hygiene, and sanitation are not just human rights, but essentials for life, health, and protection against diseases. And it is no wonder that the highly contagious COVID-19 needed water as one of the major tools to fight it. Hygiene is the #1 prerequisite for prevention. Therefore, people are required to use personal hygiene. Personal hygiene, I mean behavioral hand washing and wearing of the masks. Social hygiene, which in this case, we've been required to do a lot of social distancing. And in the beginning, it was stay at home. Then the scientific hygiene, which has been disinfecting often, sanitizing surfaces and people, using soap and detergents with alcohol-based solutions. There has been a rise in unsafe modes of fecal matter disposal, meaning that there are several people who are getting infectious diseases through contamination of water sources. According to the World Health Organization and Unicef, their reports state that Uganda by 2019 registered at least 18% access to basic sanitation services. Their research recommended the need to map water sources and sanitation facilities, identify sources of pollution, and assess facilities and the quality of water used by the country. Globally, improving water sanitation and hygiene has the potential to prevent at least 9.1% of the disease burden, or at least 6.3% of all deaths. A report by the World Health Organization suggests that higher levels of wash services can significantly reduce diarrheal diseases. The availability of wash services can significantly reduce diarrheal diseases. The wash services at healthcare facilities are essential for preventing, treating disease, and also reducing the disease burden. Due to the fact that COVID-19 is mostly transmitted by both aerosols and contaminated objects and surfaces, WASH plays a critical role in reducing transmission. UNICEF has recommended that WASH services, habits, and systems must penetrate the homes of every human on earth. How do we know this? We know this because we have experienced deaths and infections that do not know boundaries, do not know classes of people, do not know the slums, or do not know the affluent. So that means it must penetrate the homes of every human on earth. The World Bank recently presented information that highlights 3 major emergency strategies in the management and mitigation of this pandemic among communities. And the first one was safe wash services in the healthcare facilities. The second one was improving hand washing behavior and the use of products like soap and disinfectants. And the third one was providing low cost and accessible hand washing water points in all communities. We have seen that. With the registration of the first COVID-19 case in Uganda in March 2020, WASH measures were employed to halt the widespread of the virus. The public was advised to wash and sanitize their hands all the time. The public places were instructed to provide hand washing facilities with soap and sanitizers. However, these were not easily available in some places. This, together with the initial shortage of locally produced sanitizers, led to slow adoption and implementation of WASH. Sanitizers were expensive and they were not easily accessible across the country. WASH, as a public health measure, can prevent the spread of several diseases, including COVID-19, if well adopted, accepted, and used by everyone. However, sanitation still remains low. The general public acceptance and attitude to maintaining these measures is so low. Massive public awareness campaigns led by line ministries and other agencies are required for proper adoption. We therefore need to review and assess our efforts for the COVID-19 pandemic through the provision of sustainable solutions for water, sanitation, and hygiene in Uganda. This webinar is focusing on the opportunities that have emerged with the WASH measures as a result of these events. And I would like to give you a bit of a background that the responsibility for delivering of WASH interventions in Uganda is shared between the line ministries of education, and that is WASH in schools, health, which is community sanitation and public health, Ministry of Water and Environment, that deals with infrastructure, public sanitation, and sewage services. A memorandum of understanding that was signed by the three line ministries in 2001 on sanitation has not translated into improved sanitation, as there have been challenges in coordination and resource commitments. Uganda's Local Government Act 1997, as amended, mandates local governments at a district and sub-county levels to provide services, including WASH, to the community and to the institutions. The local governments are also mandated to provide adequate support for the operation and maintenance of water system in liaison with the Ministry of Water and Environment. The Ministry of Water and Environment is charged primarily with establishing and implementing and enforcing the rights and responsibilities framework regarding WASH alongside the said other ministries. So having said that, there are instruments that support this function for the ministry. And these instruments are legal instruments. We have the NEMA Act of 1994. We have the Constitution of 1995, the Water Act of 1995, the Local Government Act 1997, the Water Resources Regulatory and Wastewater Discharge Regulation 1998, the Public Health Act of 2000, the Land Act of 1998, and the Environmental Policy Act of 2005. Despite the existence of these legal and policy frameworks, key limitations have been identified. And these include the fact that sanitation was not existent at public service level. Data on WASH service delivery was also inadequate. The returns on investment on WASH infrastructure were also low. There has also been no evidence of any dedication by the three line ministries working together to a strategy of using WASH as a way of reducing the COVID-19 pandemic. Now we know that the JMP post of 2015 working group by the World Bank proposes that by 2030, all health centers should provide all users in Uganda with basic drinking water supply and adequate sanitation facilities and hand washing and menstrual hygiene facilities. In Uganda, again, our Vision 2040 projects that universal and equitable access to safe and affordable drinking water for all should have been achieved by 2040. Further, it aims at ending all open defecation and pays special attention to the needs of women and girls in those vulnerable situations. Some notable progress has been registered, and I would like to mention some of the things that we have seen during this period of the COVID-19. For example, we have seen piped water through the Mukono Katosi project. It is reaching Greater Kampala North. Several boreholes have been drilled by several NGOs and charitable trusts like the Rotary. And I am privileged to have seen about 11 boreholes in the last 10 years. And just most recently, about 5 boreholes have been drilled in my work at Concern for the Girl Child and with the Rotary. I've seen several boreholes. I've been at commissionings of several boreholes. Training of water user committees by NGOs and local government water departments. Promotion of hygiene and prevention of COVID-19 through community TP taps. That was a great initiative by the communities. And then we have the ingenious Makerere University innovations of the touch-free water centers where people simply press on a pedal and can access soap and water. And then we also had the massive sensitization campaign during this pandemic that have been held by both the Ministry of Health and different other agencies and private sector. Those have been wonderful, wonderful innovations. But now I'd like to talk about the impact of COVID-19 specifically. The need for water, safe water, hygiene and sanitation services in households, health centers, hospitals, public centers, facilities, and government offices has escalated due to the COVID-19 pandemic. Therefore, investing in public health infrastructure has become urgent for the prevention management of the pandemic. The inequality in infrastructure services must be addressed. According to WaterAid, 48% of the urban household in Uganda accessed piped water, compared to the 9% of rural households. Hand washing was recorded at only 30%. Hand washing facilities and the promotion of hand hygiene became more critical. There has been an increase in safely managed and operated hand washing services at entry points of work, public centers, health centers, markets, governments, and public offices. The WASH sector budget for the financial year 2020-21 was boosted by 52%, which is an additional 589 billion Uganda shillings. That was written by Martin Fowler in 2020. On the 27th of March this year, the National Water and Sewerage Corporation and Kampala City's Capital City Authority rolled out 300 new hand washing water points across the city of Kampala. This they did also hand in hand with the Roofings Limited. They also mobilized emergency support to secure extended water services in water-stressed urban areas. With Roofings and MTN, the National Water and Sewerage Corporation agreed to provide low-cost water service arrangements for approximately 30,000 residents in Kampala, maybe. And they purchased 100 plastic water tanks of 10,000 cc capacity to serve as emergency reservoirs. But these reservoirs were supposed to be supportive to residents who would pay for them at a subsidy. National Water Sewerage Corporation also suspended disconnection fees for non-payment of water bills. These were great initiatives. Now the question is, how sustainable is it? Because now the pandemic has escalated. We're talking about 20,000 infections and over 200 deaths. Can this sustain the trend that we're looking at now? At the community and rural level, major adjustments had to be made regarding the utilization of water sources by the communities. Social distancing at boreholes that are normally places of washing clothes and social interaction has been a big challenge. The need for soap, detergents, sanitizers, and clean water presented a strain on communities that could not easily access this water. It was also revealed that 22% of the Ugandan poor's income is spent on purchasing water from vendors, thus reducing their household incomes. I feel that it's no wonder people chose to cry out, please open the lockdown so that would rather have work and not die hungry, because that is one of the biggest challenges that contributed to poverty during the lockdown. Now, what gaps have been exposed during this period that we're looking at? Inadequacies in water, hygiene, and sanitation in the slums and urban areas. That water is not enough to manage this pandemic, especially in the rural and slum communities. And yet we now know that whether we live in the rural or urban communities, once the spread of infection happens, it does not know which community is affected. It will spread to every person. A second, National Water and Sewerage Corporation policies on profitability. They render many Ugandans poorer by charging levies on water services in a season that requires an emergency intervention. So providing emergency response initiatives on water reservoirs and transferring it to residents at a subsidy simply makes it difficult for us to manage the pandemic when Ugandans cannot afford water services. The water table shortages. This is felt mostly in the cattle corridors, and I've been able to work in Nakaseke and Nakasongola and seen that these changes or these short changes do not enable us fight this pandemic. And that means that there was no planning that was mitigated by the Planning Department of Research and Development. What other gap? There was a poor management of boreholes by the communities themselves. We have experienced that as NGO workers. We go into the communities, we ask them for their needs. They come up and say, we need water. We sit with them, design solutions, and provide boreholes. But at the same time, it is not our duty to make sure that we cater for those boreholes. The community is responsible. And when the community does not manage these boreholes well, it affects the most vulnerable, who are girls, women, and children, and the elderly persons and those with disabilities. We've also seen the lack of public toilets, whether in the cities, highways, or in public transport. This poses a great risk to all populations, whether they're urban or rural. High poverty levels. Without resources, people could not easily purchase soap, detergents, and sanitizers. Water pollution, especially in the urban areas due to poor city planning and lack of drainage facilities. Then we had also an experience of the floating islands that affected the water dams in Nalubale. We've also had an issue of financing of WASH. Despite the fact that the water allocation was increased by 52% in that financial budget, while all other sectors of the economy were being given a supplementary budget, this sector did not receive, and yet it is the most critical to the prevention and management against the fight against COVID-19. And yet it's also the most least cost effective, you know. So I want to talk about the challenges that have been posed. We have experienced resistance to the recommended behavior change by communities. People have refused to uphold hygiene standards, including hand washing, wearing masks, social distancing. It's just been difficult. There's been poverty amongst the populace, lack of resources. People cannot afford soap, detergents, sanitizers, and masks on top of basic needs for livelihood. And then we've also had the silo approach to managing the pandemic. Different players have provided emergency interventions, but there is no coordination. We need to work together more than ever before. This is the time for us to have combined and strategic solutions. We've also had an issue of the national campaigns and the election season. It was evident that the discipline during the lockdown has vanished since the campaigns and elections started. That means the infection rates are going to spiral out of control. And until something is done about it, we cannot pretend not to have this under control. So what opportunities have come up? What opportunities have emerged from this period? There is an opportunity for us to have mass sensitization on WASH, and this pandemic has provided the nationwide platform for sensitization beyond the COVID-19 pandemic. It is important for us to have a great WASH strategy, but also communication to communities to practice best sanitation habits beyond this pandemic. There is an opportunity for us to reevaluate access to clean and safe water. The pandemic has provided government that opportunity right now, and to generate a return level towards the Vision 2024. There is an opportunity for the private sector to engage in such a crisis, okay? And I think that they can do this by supporting government to address issues like providing subsidized loans to households for industrial and domestic rainwater harvesting by households, hospitals, and hospitality industry. There's an opportunity for government and the rest of the Ugandans to pay attention to the environment. The importance of water has been highlighted. Therefore, this is an opportune time to address the restoration of degraded and fragile ecosystems like wetlands and riverbanks and lake shores. Then we have also seen an opportunity to deal with disaster and scenario planning. The sudden onset of travel restrictions and lockdown displayed the dire need for disaster and scenario planning, especially with regard to water security. And what recommendations have we come up with as I conclude? We have seen, and we would like to recommend, that though blessed with abundant rainfall, okay, we have 2 seasons of rainfall, there is hardly any water harvesting in the country. Government should consider making it a policy requirement for all buildings and homesteads in cities and rural areas to harvest and treat rainwater. And a fund could be established to do this. To review and strengthen existing policies on the protection, preservation of natural water resources. Research and development, there is need for that to lease some of the unproductive land as water catchment or reservoirs in the parts of the country. Hygiene and sanitation, government should budget for the construction of public toilets, massive construction of public toilets and hand washing and hand room facilities along the highways as a potential source of income. This could be done in partnership with the private sector. Players like the fuel stations that are already filling in this gap in some way. Government should provide a framework for the enforcement of proper hygiene and sanitation in all public facilities. And NGOs should be included in doing the monitoring and reporting. Toilet management, there's need to look at a national toilet management strategy in Uganda. And I think this should be something that we could take on, and the rest of the world can take an example to look at Uganda. There's waste disposal. There's need for provision of decomposing facilities for all disposable sanitation materials. Look at the pads, diapers, and the masks. How shall we decompose these unless we use maybe large-scale incinerators? We need to think about this seriously because this is draining our drainage system. Recycling should be given to recycling plants to protect our environment. We should have a policy that requires all private factories and industries to manage and recycle waste urgently. I'm looking at Renzori Bottling Company ensuring that Ugandan streets do not have bottles that have that label on the ground, you know. If they take that responsibility, then that will be something that will motivate us. Highlighting hand washing campaigns, recognizing and celebrating best practice by the Ministry of Water and Environment. This is something the ministry can take on, and it would motivate the private sector, it would motivate communities. And as I conclude, I'd just like to say this. Uganda has the human, intellectual, and financial resources that can provide solutions to WASH challenges. With enabling policies, well thought out strategies, and the commitment from our leaders in both the public and private sectors, we can create a cleaner environment with fresh water access available to all citizens in a way that is sustainable for the continued enjoyment of future generations. Thank you very much for having me.
Wow, wow, wow. Thank you so much, Catherine. That was a very great presentation, well prepared and well presented. I hope our participants are all geared and all other panelists are all geared into the next steps, into the next discussion. Once again, Catherine, thank you so much for the great presentation. We are going to receive the first poll question before we go to the panelists. Please watch your screen. The poll question will be coming in shortly if it is ready. I am giving it, yes, the poll question is now with us. And the question number 1 is about the cost effectiveness. So it says, is applying WASH concept the most cost effective strategy for preventing and protecting Ugandans from COVID-19? Option 1, yes, it is very effective, but Ugandans need to get serious in applying it. Option 2, yes, but it is still too expensive for most Ugandans. Option 3, no, there is not enough discipline to make it effective. And option 4, I don't know. Dear participants, please respond to the question using the appropriate answer and opinion according to you. Once again, panelists, you are not able to vote. So you are observers and watch what is happening. We are giving it a few seconds and we will be closing it in a few seconds. I'm monitoring to see if the responses are coming in. The poll is in progress. Is applying the WASH concept the most effective strategy in preventing and protecting Ugandans from COVID-19 and almost other infectious diseases, if you can add. So your answer, please. Thank you so much. I see options coming in. We give it a few more seconds and we should be able to cross. Okay, thank you so much. Our responses have just come in and most participants believe 70% that yes, WASH is very effective, but Ugandans need to get serious in applying it. The closest response came to 30%. Yes, it is effective, but it is still expensive for most Ugandans. If you look at the option 1 and 2, almost you get 100% that WASH is the cost-effective strategy. Actually, option number 3 got a no, and others I don't know was just 10%. Thank you so much. The statistics speak themselves. Thank you so much, and now we close the poll and we prepare to welcome our first panelist in this webinar. And our first panelist, she's going to be Ms. Mukasa Hajara, Program Manager, Water, Sanitation and Hygiene, AMREF, Health Africa, Uganda. Allow me to welcome Hajara, but before she comes on the stage, allow me to introduce her more in detail. As I've just mentioned, Ms. Mukasa Hajara, she's the WASH Program Manager who provides technical leadership to the WASH programs at AMREF Health Africa, Uganda, to realize organization's vision of lasting health change in Africa. She's a public health specialist with a bias to sanitation hygiene promotion with a circular economy lens. She has over 15 years of experience that ranges from local central government to international non-government organizations. She has innovated the sanitation digital solution system that brings sanitation and hygiene to stakeholders and beneficiaries together by just a click of a button for better planning and coordination. Over the years, Hajara has led programs that produce best operational practices that have featured in the country's annual sector performance reports. She is very passionate about the development of innovative sanitation solutions to offer sustainable and inclusive services with a focus to circular economy and leaving no one behind. She holds a Bachelor of Environmental Health Science and a Masters of Public Health from Makerere University. And before I conclude, I need to repeat this. With the circular economy and leaving no one behind is very, very important as part of her advocacy. Allow me, participants and fellow panelists and our special guests, to welcome Hajara as our first panelist. Hajara, you are most welcome.
Thank you very much. I am happy to be part of this discussion this morning, especially when I'm joined by my teacher and the one person that I admire the most, Ms. Julian Chomuhanji, the first health inspector in Uganda and the first Commissioner of Environmental Health. And thank you so much, Catherine, for such a detailed presentation. Thank you, CASO Think Tank, for bringing up such a detailed discussion, bringing out the opportunities, clearly stating out what could be done differently, and then also bring out the challenges and such clear recommendations. I must say, I really agree with what this paper brought out. And I'll start from saying, I love the fact that the paper also challenges the sustainability of all the interventions that were done during COVID-19. I would just suggest that if we could, let's not just challenge the services, but let's also challenge the behaviors. Like Catherine mentioned, people are seemingly resistant, but we know that at one point during COVID-19, people actually oblige to the recommendations. So if people oblige to the recommendations, what could we do to make sure that we uphold to the behavior changes that we realized? We also see the paper brings out the multiple benefits of WASH and the evidence that WASH comes along with when rightly implemented. I want to echo that I wish we could also look more into the missed opportunities that the opportunities we missed during our response to COVID-19. For instance, like Catherine clearly brought out, Chris Tang, Ministry of Water and Environment, and other partners, very many NGOs, including AMREF Health Africa, IRC, WaterAid. Everyone responded to providing hand washing facilities, but our focus was so much on emergency response. Don't we see a missed opportunity in that angle? Don't we see that if we had pulled these resources together, as opposed to only providing temporary structures, what if we had merged temporal versus permanent structures? Wouldn't we still have those in Kampala? I live in Kawempe division, and one time during very strong winds, I saw hand washing facilities fly over my house. So because the wind was so strong, how about those missed opportunities? Could we look at them more? And then when we say that people want to be forced, and also the poll brings it out clearly. Yes, people want to be forced, but why do they want to be forced? We've seen, I want us to look at the way cars are advertised. A car will be advertised, and irrespective of whether you have the money or a phone, you feel compelled to start planning and budgeting for that car and for that phone. How about we look at WASH as we look at designs in a more appealing manner, even if there were designs to COVID-19. As the think tank, you guys are the think tank, can we look more into that angle of bringing more triggers to hand washing, like good enough triggers, good enough designs, just like we see certain behaviors that have been routed in communities, like brushing our teeth. It's also a hygiene practice, but then we brush our teeth. What is it that we can learn from such behaviors that have entrenched themselves in communities? I love the statistics that Unicef brings out. In my opinion, it is always very amazing when statistics are also brought to local context. I hope these were there, but maybe just not presented. It gives, so we know 9.1% disease burden reduction, but I know that in Uganda, it's bigger. So bringing the local context of statistics would bring it more to the realization that making it more concrete that investment in WASH has to be the in thing. Because there's evidence, everyone knows about this, but how comes that the investment in WASH is still, especially when it comes to hygiene, water becomes the son of the family, sanitation becomes the cousin, then hygiene ends up being this forgotten cousin, actually forgotten step cousin. Why don't we, and yet we have all this evidence. How about we bring more statistics that trigger people to action? And then also thinking about what we can do differently, but do it together. We know we've done what we've done in COVID, but then we are seeing, like this paper brought out, and we've also realized this, there's now backsliding. There's backsliding, there's a lot of myths, misconception that is making people forget to wash hands, making people opt to die. Someone in Arua said they wanted to be the first person to die of COVID-19 to believe that there's COVID-19. So that means we need to do more. So we know the facts. And then we have all these recommendations from UNICEF, from GMP. But these recommendations are just saying we need to do this, we need to do this. Can we have a think tank that comes up with the how? Because we all know that we need to do these things. How about the how? Like say we say, if we provided water using boreholes, true, we are providing water, but how can we bring this water closer to communities? How can we invest more to make sure we have true water, but then realize my former minister's desire. The Minister of Water one time said, women's heads are not designed to just carry water. Our heads are designed to think and not to carry water. How about we do the how? And then the low cost. I've realized we have very many innovations in hand washing, as this paper brings it out, especially during COVID-19. We had the tippy taps in communities. We had all these other elbow aided hand washing facilities. But then, you know, all these are jerry cans that are movable. Communities will complain about people stealing away their jerry cans. But I want to believe that we can do better. We need to start thinking of how, like, I remember when we were young, we had pots that would be glued into the ground and this pot just can't move away. How about we think about doing things that even at low cost, using the community initiatives to make them more sustainable, so that we tackle both the adoption and acceptance. There's one clear fact that when something is in your face and reminding you all the time, you're kind of forced to do it. Like if you have a hand washing station that is in your face all the time, chances of you washing hands and then this becoming a behavior becomes high. I want to also speak to coordination and resource allocation. So the problem here is that, especially for us in the NGO world, we thrive on visibility, we thrive on accountability, we thrive on what the donor wants. But I know that the government has given us an enabling environment to operate. Government has made sure, I think Uganda is one of those countries that NGOs will thrive and do whatever they want to do. But we need to think, the think tank need to start giving us recommendations of how we can improve coordination and also how we can unpack the dissemination, especially when you talk about the MOU. This MOU that was signed, it's interesting that some people in these key ministries didn't even know about this MOU. Was it an issue of us as being Ugandans and our culture of not reading, or was it an issue of dissemination? Can we look deeper into this before we just conclude that, okay, this MOU was not upheld because of lack of coordination and then biased resource allocation? And then I want to, this is not in defense for communities that we serve. This paper brings it out very rightly that the communities received water resources during COVID-19. But then the paper also says there was poor management of these boreholes. Yes, there was poor management, true. But can we also look at the quality of boreholes that we give? I have been to places like in Toroko, where the water has a lot of iron. Engineer Okero will talk to this. When I was still working for Minister of Water under the TSU, you go to a borehole that was sunk, but you'd never want to use that water. And so ultimately, community looks at it, it attracts vandalism because no one wants to protect this. How about we look at the quality of the water system that we provide? Let us also look deeper into the quality of the service management system in place. I know we always say we trained water user committees, but what did we train? How long did the training take? Minister of Health and Minister of Water have got community extension workers manuals and guides. Us as NGOs, do we ever use those? I think if we could unpack the quality of O&M systems and also the community involvement. We are quick to say there's community involvement, but is it meaningful involvement? Are we looking at communities as beneficiaries or as partners? And if we claim that we're looking at these communities as partners, what are the indicators that show that these communities are our partners? Because when we have this meaningful partnership, then communities are bound to accept and uphold what we give them. Then the issue of silos implementation, I already hinted to this, NGOs, silos implementation. How I wish there was a law, maybe there's even a law that forbids anyone who goes into a district to work entirely alone, but then first map out all the people that they work with. I am not the think tank, but I know the think tank guys can really give us, unless we unlock this problem of silos implementation, then we will still have wastage of resources. Because if I come to an area.
Yes, Hajara, just a minute.
So,
okay, go ahead.
Yes, so to conclude, I would like to say that government, in addition to what government does to create an enabling environment, government should really strengthen private sector involvement by doing some of the things that Catherine said, like recognition, but I'll also want to really echo that the sector performance report should really tap into the unintended outcomes that come out, especially when it comes to highway sanitation that the private sector brings on board. Because I read the sector performance report of this year, and highway sanitation made no mention of the private sector that had invested in highway sanitation. When we do that, then people will be compelled to invest more because they will feel that they are part of the system. I thank you very much for giving me the opportunity to be part of this.
Well, thank you so much, Hajara. That was very excellent discussion. We are very grateful. Please, with time, keep checking on Q&A area, see if there are any questions that are being posted. Meanwhile, I'd like to request all our participants attending this webinar that we need your participation. Go to Q&A section, type in your question, your comment. Our panelists, our chief guest would like to hear your views and to be able to shape what is happening with WASH in our country. Please, we'll be very grateful to hear from you. So before we call the next panelist, we are going to have another poll question. Please just watch your screen. It will be coming in shortly. Again, take a few seconds to respond to the question, and we will be closing just in a short while. The question is there for you, and it reads as follows. In the Ugandan context, what do you think would be the most effective in containing the spread of COVID-19? Please check the different options. Unfortunately, my screen has lost the options, but check the different options on your screen and be able to respond accordingly. We'll give it a few more seconds and we should be able to get your responses. Please check the options. I'm not able to read them for you right now. My screen was lost the poll questions. Please check on your screen, read, give us your feedback. In a few more seconds, we'll be receiving all the feedback and closing on the poll question. Okay, a few more seconds. Okay, thank you so much for responding. We got few responses on this question. Nevertheless, the number one, improving water sanitation hygiene, came up strongly with 36%. The next one, we have two ties, improving health services in hospitals and medical centers at 29%, increasing efforts towards sensitizing the public about COVID, also 29%, and none of the above, only vaccine will save us at 7%. Thank you so much. We are very grateful for these responses, and they will be incorporated in the final output paper. Thank you so much. We are now going to go to our second panelist, and our second panelist is Dr. David Musoque. Allow me to welcome Dr. David Musoque as our second panelist. Before he comes on the podium, let me introduce him. Dr. David Musoque is a lecturer in the Department of Disease Control at the Okero University School of Public Health. He's a secretary for the International Federation of Environmental Health Africa Group, as well as a chair of the African Academy for Environmental Health. He has spearheaded the organization of the third World Academic Conference held in Kampala in 2019. He has also participated in extensive research in environmental and public health, including water, sanitation, and hygiene, which has disseminated extensively, including over 50 peer-reviewed publications and 70 conference presentations. He is a coordinator of the short course in WASH at Okero University. Dr. Musoque is a co-chair of the Community Health Workers Thematic Working Group of Health Systems Global and a senior visiting fellow at Nottingham Trent University, UK. He is an external examiner at the University of Malawi, National University of Science and Technology, Zimbabwe, and Uganda Matters University in Kozi. David holds a bachelor's degree in environmental health sciences from Okero University, a master's in international primary health care from University of London, and a PhD in public health from Cardiff Metropolitan University in UK. David, you are warmly welcome to speak to us and speak to all the participants and the viewers attending this webinar. David, you are most welcome.
Thank you very much, Dr. Mugisha, and thank you for the warm introduction and welcome. I'm really pleased to be part of this webinar to share and listen in from colleagues. Thank you, Catherine, for that well thought through piece. I really enjoyed listening to it, and I wouldn't agree more with you on many of the issues. And indeed, I'm pleased that our thinking is pretty much in sync. But also to thank my colleague Hajira for again really giving a very good input that indeed is very relevant to this particular discussion. So as I said, the piece really for me was spot on, and I wouldn't agree more on many of the issues. I just wish to again situate WASH into the broader environmental health, and again using my my hat as an academic to really bring out where WASH falls, but also a few other issues concerning training, especially that I felt could have also been included in the piece. So just for those who may not know, WASH is not a standalone discipline, but actually falls within what we term as environmental health, which is really a discipline that looks at all aspects in the environment that have an impact on human health. So WASH being one of the subsets, if you like, in environmental health. Other subsets include things like waste management, things like food hygiene and sanitation, vector control, and many others. But actually, you'll find that in our developing countries, WASH normally stands out quite strongly regarding environmental health, given that there's a very high disease burden that is related to WASH. So diseases such as diarrhea, cholera, typhoid, and now COVID-19, again, emphasize how important WASH is in our local setting. And in terms of the opportunities that the piece brought out, many of them I would agree entirely, but probably the one opportunity I felt could have been strengthened is the training component. And again, with my academic hat, this you would expect would come out. So for those who may know, WASH, of course, can be trained as a standalone field, but many times in our training, we look at it in the broader context of environmental health. And many people would know that if you look at environmental training in Uganda, we have several institutions that are currently training either at certificate, a diploma, a degree, and master's level. So for example, we know Makerere, Mbale School of Hygiene, we have Cavendish University, we have Kabbalah University, and all these are training at various undergraduate levels. But one opportunity I believe now is that can we look at more institutions actually training environmental health so that we have more cadres that can be at the forefront of promoting WASH and other disciplines. That I think is an opportunity that we can harness as a community. But also having in place more advanced qualifications. And as I said, there are many holders of undergraduate degrees in environmental health. But can we also now appreciate more the need to have master's programs and PhD programs in environmental health? And I know people, think about environmental health only in terms of practice, but I think we also need to think about environmental health and WASH in terms of research, in terms of teaching, in terms of innovation. So with those higher advanced qualifications, we would find that in the long term, we do better as a country. And again, some of these opportunities are not short term, some of them are long term, but I still think there are things that we should think about moving forward. But also, besides environmental health in the broader sense, can we now think about WASH specific and tailored courses that can be developed by universities, by institutions, by organizations, again, to enhance capacity of the various players in WASH? So for example, at Makerere, we have a WASH short course, but I wouldn't say that it's really good enough. We wish to see more institutions training a WASH. And for your information, participants, this short course wouldn't necessarily be tailored to only environmental health or health practitioners, but other disciplines that are involved in health. be it social sciences, be it people doing, business, because as we have now seen, WASH is a business for us all and not just for the health sector. So if we have such short courses, they can also be helpful. But also specific advanced courses, for example, master's courses in sanitation and hygiene. I know, for example, at Cranfield University in the UK, they have a Masters of Science in Water and Sanitation for Development. But also at IHE Delphi in Netherlands, they have a Masters of Science in Urban Sanitation and Water. So can we as a country look at also developing tailored masters and other programs that are specific on WASH to again enhance capacity in this particular sector? But also moving forward, now that the country recognizes the importance of WASH, can different universities, while they are developing their curricula, explore how other programs beyond health can also have a component of WASH? So for example, people are studying nursing or social sciences, can their program also have a module on WASH, so that at least when they graduate, they are really well versed with WASH, and therefore in their practice, in whichever field, they have that WASH heart and thinking whenever they are doing their work. Then in terms of research, I think I can't emphasize this more. As researchers, we need to do much more to generate more evidence. A lot of evidence exists in terms of WASH and how WASH has really been instrumental in promoting health, but I still believe there's much more we can do as researchers. For example, how can we, Catherine and Hajira mentioned multi-sectoral collaboration and the challenges it brings. How can we as a nation carry out this multi-sectoral collaboration better? So research evidence is needed to ensure that indeed this collaboration is achieved better and that we perform better in this particular field. But also in terms of behavior change, we've seen and heard that we've seen some behaviors change over the past so many months, but which approaches are really ideal to have this behavior change sustained and for us to really see these gains stay for a long time? So that could also be opportunities for us in terms of research. And lastly, in terms of innovation, I think you brought it out, Catherine, very well, and Hajira hinted on it. In terms of innovations we've seen in the recent past, including the touchless water hand washing facility we've seen from Okero, we've seen the pedal and foot operated facilities, which I think is great. But for me, my concern, and Hajira hinted to it as well, many of these technologies we are seeing are really high tech and high level. You'll only see them, in urban settings, at institutions. But for a rural person deep in the village, how are they going to get access to, a touchless hand washing facility? And that for me calls for the need for us as innovators to think of how we can innovate low cost, easily accessible technologies. And I was in touch with one of my students recently who was thinking of a simple innovation of having ash and lemon peelings to develop a small kind of something that can be used to wash hands at local level. And again, this could be something that sounds so simple, but at least it may easily be accessible by somebody who is deep in the village, in the rural area. So for me, low-cost innovations are critical because the high-cost ones may not necessarily reach many of our populations. But lastly, for me, one of the points you brought out, Catherine, as I wind up, is the opportunity for mass sensitization on WASH. I can't agree more on this. And indeed, as a country, we need to really harness opportunities to see how we can make the community aware of what they're supposed to do concerning WASH. And for me, one of the key strategies we need to embark on is how we can work better with the community health workers who are village health teams in our local settings. These, I believe, have a good reach in our populations. And if their capacity is enhanced and indeed they are well equipped with what they're supposed to do, I can assure you they can play a critical role to really support WASH in local communities. I was pleased to hear of the launch of the National Community Engagement Strategy for COVID-19, which I understand is going to involve these community workers. But I think we ought to see how indeed they're going to be empowered to perform better and be at the forefront of promoting behavior change concerning WASH in their communities. Thank you very much, and looking forward to further engagement as the webinar goes along. Back to you, Dr. Lawrence.
Okay, thank you so much, David. Well said about research and capacity building. Thank you so much. The presentation and the discussion was very clear. We are going to have the third poll question, but before it comes in, once again, I call upon our participants to go into the Q&A section. submit your question, your comments. Would like to hear from you. I see them coming. Let them continue to come. And our participants, please check there and see what kind of comments and questions are being put there. Let's have the third poll question before we go to the next panelist. Just watch over your screen. In a few seconds, we'll be having the next poll question. Okay, here it comes. And it's about hand washing water points. In your view, is providing low cost and accessible hand washing water points in all communities a solution to stopping the spread of COVID-19? Option number one, yes, because when such facilities are easy to access, people will increase their use of them. Option two, yes, it would be an important step in culture change. Option number three, no, it will not work because it is not a lack of access that is hindrance, but rather our culture and behavior. Fourth, no, because the supply of water and detergent will still be a problem. Our dear participants, please respond according to your best view and option, and we will be removing the poll question in the next few seconds. And I repeat again, in your view, is providing low cost and accessible hand washing water points in all our communities a solution to stopping the spread of COVID-19? Participants, we want to hear your view. That is the best way of participating in this webinar. I would wish to see the participation in this poll question at 100% of the participation. We have four options. Option number one, yes, because when such facilities are easy to access, people will increase their use of them. Yes, it would be an important step in culture change. No, it will not work because it is not lack of access that is the hindrance, but rather our culture and behavior. No, because the supply of water and detergent will still be a problem. Over to you, and we'll be closing out shortly. Okay, can we have the poll response? Yes, thank you so much. Improved participation, I'm grateful. Option number one, yes, comes with 53% because when such facilities are easy to access, people will increase their use. The next option comes to two of them tying at 18%. Yes, it will be an important step in the culture change. And no, it will not work because it is not lack of access that is the hindrance, but rather the culture and behavior. And lastly, no, because the supply of water and detergent will still be a problem. Thank you so much for your response. We are now going to proceed with our webinar discussion by inviting the third panelist this morning. And our third panelist is Mr. Shiva Singh, the Program Manager, Water, Sanitation and Hygiene, Unicef Uganda Country Office. Before he comes to speak to us, allow me to introduce Mr. Shiva. Mr. Shiva is the Program Manager, Water, Sanitation and Hygiene at Unicef Uganda Country Office. He has garnered over 33 years of professional experience in the wash sector, having worked in Kenya, Ethiopia, Somalia, Sri Lanka, and various states within India before coming to Uganda in 2018. He is very passionate about innovations in wash programming strategy, and he has contributed to developing innovative strategies and tools in wash sector and applied them in practice. He holds a master's degree in civil engineering and sociology. And allow me at this juncture to welcome Mr. Shiva to talk to us with that vast experience, having worked in several different countries, and now being privileged to have you, Shiva, in Uganda, and more importantly, talking to us this morning. Shiva, you are most welcome.
Thank you. And first of all, I would like to thank the Castle Group for inviting me, and I'm very happy to be part of this discussion, which is quite engaging. And I can see that many issues have been already brought out. But I just like to say we don't need COVID to remind us the importance of hand washing. I think this has been a known fact. I'm sure that all the public health experts and our listeners would be knowing that how this hygiene importance came sometime in the early part of the this 19th century. So it's a lot of evidence are there, and I'm not going to kind of relay that, but I'd just like to add to one evidence that you may have water, you may have toilet, but if you don't have hygiene practices coupled with that, the health impact of water and availability of toilet is not going to accrue in terms of the health benefits. The other aspects that I would like to highlight is wash is now regarded as a human right in itself, as much it is a key determinant of a good health. So that also we have to see that when we are talking of wash, this is something like a human rights, and we have to see in that context as well. Now coming to COVID, we have seen that pre-COVID, the data that was shown, about 1/3 of the communities who are aware about the hand washing, or they have the facility in their homes. But then the post-COVID, we have seen that this has kind of a increased this sensitization. And there was recently a survey done by our UOSNet colleagues, and it showed that almost more than 90% families, they understand the importance. But as the topic and as the purpose of this our discussion is also how we can convert into an opportunity to sustain these particular aspects. I think that is the purpose for which we are here. And I'm also reminded of one of the key behavior change, kind of a I would say paradigm, why people change behavior. And one of the things that has come, it comes out of fear. So it is a fear which makes you change those behaviors. So then are we saying that once this COVID, whenever it will go, is it going to be like a spring action? That this 90% adherence, wherever they are, it's going to come back. And so now that we are over with this problem, and let's go business as usual. And that is a challenge that we have to think together, how we can sustain that. So that one aspect I would like to mention. The second aspect I would like to mention here is also, I have been going around the shops here, and I can see a very visual change. You can see so many products of our hand washing have come up. So that's another opportunity as we see it now, that how this can be further sustained. The other element that I would like to bring to your aspect, that is very known, but it's important to note that especially in the context of COVID, there was a question where prevention or cure, hospitals and this hand washing was there. But it's a known fact, prevention is better than cure. That is what we have been taught all over our lives. But then the issue is that how do we prevent it? And especially we know that in this COVID, there is no cure as of now as we speak. It's all symptomatic, kind of a response that is there, but there's nothing which is cure is there. We are still struggling to find the vaccine. I don't know when it will come to a country like Uganda. We see all newspapers, all these things that is happening. So the most important part is that how do we have this hand washing? I think that is one. And I would like to bring one kind of an issue, that when we have the hand washing, it requires two, as you saw in our questionnaire, water and this soap or other products. But we also got to have an alternative, which is the alcohol based, where it can give you those options as well. So the various products which are there and how we can combine it together. And I think one of the panelists asked, challenge is there, but the whole issue is that how do we go about it? So I would like to delve some time on how to go about it in the given situation, and especially in the context of Uganda, because we are in Uganda and I would like to talk in the context of Uganda. I would like to put into three brackets. One, the demand side of it. Second, the supply side of it. And third, the enabling environment part of it. That is the rather role of the government. I think demand part is mostly, I would say, is being pushed by the situation itself. The COVID, the fear is creating that demand. The issue is that how that can go to the everywhere, and where we see, okay, one of the heard the speaker that people really believe, is it really COVID? Is it there? I think that's something we have to see that, okay, people who have faced it, one has to think of that, how they have suffered. One person in the family, and how it brings the entire family, this specific challenge that we have got. It's a very different disease. It's not a normal disease. It takes, there is so much stigma attached to that. People don't want to even share also about that they have indeed have the COVID. So those are the challenges that we have to kind of address. And it is just not one way of doing it. There has to be done many ways of doing it. So that one I would suggest. But I also see a silver lining. We have seen the responses that are happening, say in the health facilities, how we can capitalize on that part and making our health system, that we have the whole network. We have this our health networks of the health workers. We have the village health teams. So we do have our existing networks in Uganda. How that network can be galvanized, and you don't require so much of investment, to do that. It's about us. It's about saving our lives, saving the life of our neighbors, saving the lives of our own kith and kin. It's not about that we look somebody else outside and they come and say, okay, no, you should not be doing it, but how we can do the sensitization. And that's something I think I can tell you. I mean, this is something that which is core of my heart. I have seen it myself. I was stuck in India for about 3 months, or I think more than 5 months actually, because of this COVID. And I could see since this, the kind of, the whole lockdown things came up, and how the cases were happening, and the whole, the entire community getting sensitized about it. And that triggered those actions. But how that sensitivity can bring in, which we are feeling, oh, it is not there, it is far away. But once it is there, you have no other option than to suffer and pray to God that, okay, everything goes well. So that's one part I would say. We have to make sure that how everybody is sensitized, use all the mediums. Whether even the public measures that are being happening. This is an election time. People are reaching to each other. How we can integrate this messaging? Just spare just 5 minutes. Make sure, are you ensuring social distancing and your hand washing? This is are the two only measures. That's it. There is no other way. So that's when I would say the key focus on the messaging using all channels that we have at our disposal as an individual or also as an institutions. Second part, coming to the supply part of it. We have seen a lot of products have come in, but then we look forward to it, how it can be further improved. And this is an opportunity, I would say that. And I'm reminded of my childhood days. As you know, in India, people travel a lot from railways. We used to travel like spending like 2 nights, even going from one part to the other part of the country. And we used to have this paper soap, where in the morning that you can have, you don't need to carry everything. You have a paper soap, you just tuck in your pocket, you take it out, tear it up, and then you can do the hand washing with that. Can we think of those kind of also innovations, and this gives up, where make things easy, make things available. Think of the person who in the last in the village, not in a shop in Kampala, how these products can reach out to them in a affordable manner. Again, I give an example of the shampoo, and I've seen it over my period of time, again, my life experiences. The shampoo used to come in a big bottles. Once they started coming in sachet, everybody started using it. We have seen even the packet of biscuits. The biscuits coming in the big packets, but going to the village, and that's how I saw it even in Kenya and Uganda. I've seen these biscuits where a packet is sold in like 3 or 4 biscuits. Again, it's a question of affordability. So those are the ways also that our private sector colleagues have to work together on that. Is how it can be made things more available, make it more cheaper, and that people will adopt it. We have seen that. So that's other aspect that I would like to highlight on the supply side of it, how it can be made available. The third part, I would say, enabling environment, where the government as well as the institutions like the universities have got a role. And first, I would like to at this point in time, I would also like to thank and congratulate the ministry, especially the Ministry of Health and Ministry of Water, as a core ministry, and of course education, all three ministries, that I heard about this MOU that is there, and that I see as an opportunity. It's a 2001 document. 20 years, not a long time, not a short time also. But if anything has not been done, there is no reason that it should not be resurrected, and again kind of a thought over how we can make it happen. Because I'm saying it, all three ministries are doing what they can do. There is an incident command system. I'm sure that our colleague from Commissioner would be talking about it. But we see that there is a coordination mechanism. But the point is how we all can contribute to that. I can share with you, that working with them, the data are not coming from the different partners. We are all, somebody said that, in silos we are working, but we can always blame others, but the point is how we are all contributing to that, kind of a system that is there. We reach out to them, let them know that, okay, this is what we are doing, what else we can do. Yeah, rather than somebody coming us, okay, no, we are in our own cocoons. So I think that that's something we need to have a reflection, all of us who are contributing to the sector. And I would like to challenge each of the partners and organizations, please put the resources in the government that they are supporting and say that this is all is a combined effort, government, civil society, and all organizations. And then together we have come over on this COVID, and that is the way we can rejoice, not end up blaming on each other. That's, I see, is the opportunity that puts all of us onto that. But at the same time, I also like to appeal to the government as well. And I'm sure we have good to have the commissioner here, just some thinking. Because this is an area, I think this affordability of those products are there. Can we think of giving some incentive to the private sector that okay, water is a long-term solution. It is important. But water, reaching out to water to every nook and corner of the country will take time. We have to accept that. 68% of villages are only having an independent water source, which are taken how many years of our since independence or maybe prior independence. So if so many years, we have still reached not even third, fourth of the country. So how we can think of the remaining part of the villages are going to have water like next day. So that means we have to think of alternatives. So that's one that I would like to appeal, that if we can have some kind of incentive to these private sector people, and what we are talking is about getting this or sanitizer. It may not have water, but sanitizer you can use it. But if it can be made only available, so it doesn't become only available in urban areas, but it can reach out to even rural area also. And then again we see, okay, not only protect yourself, but how do you protect others? So that's the one point that I'm saying. Before I conclude, I would like to make 2 more points. One to the research institutions. I think still the research and development has to continue. And that I would see the rainwater harvesting system. How the rainwater harvest, it's a very simple solution, but it is not adopted. Why it is that? We have to take a step back. And I think that's an area where our research institution can work and provide a good option to the household. They are making their houses at their afford. They are not going somewhere to ask institutions, But then how we can have a appropriate rainwater harvesting system so that anybody can build it. They don't look at it. And I would like to point it out here at one more fact for Uganda and as many other countries. Sanitation and hygiene, especially in the Eastern African countries, it is the household which spends more than what government spends. It is up to us how we can trigger that change with this knowledge. I think that is all I would say.
Mr. Shiva, you can conclude.
Yes, thank you. And that is all I'm almost at the end of my sharing my thoughts. But I would like to conclude by thanking you. But I think I say this, somebody said that this should not be a talking shop, but this should kind of a trigger actions. And on that account, I think I would be happy from Unicef side in whatever way we can contribute further or any ideas, any thoughts that come in. And I wish the further discussion and further action, a very enriching one, and to make this COVID as less people affected as possible in our hands. Thank you so much for giving this opportunity. Thank you.
Okay, thank you so much, Mr. Shiva. That was very, very excellent, especially when you brought in the of water harvest innovations, which is not happening, and yet it provides a very, very excellent opportunity for water access and provision, especially in rural areas. Thank you so much. That has been noted. At this point, I'm going to proceed to the next panelist. We will have the next poll question after this panelist. So allow me to invite Engineer Wilfred Okero, who is going to speak to us as our next panelist. And before he comes on board, let me take this opportunity and pleasure to introduce Engineer Wilfred Okero. Engineer Wilfred Okero is a senior engineer, water and sanitation specialist in the Ministry of Water and Environment. He's a licensed registered civil engineer in Uganda, and he has spent entire 14 years of his career journey in water and sanitation sector. The recent half of his career has been at the Ministry of Water and Environment, where he has served as a water and sanitation specialist and senior engineer. The earlier half of his career has been with premier agents, World Vision, Geotech Engineering Limited, and United Nations, where he has, as well as other public health infrastructure projects. Engineer Wilfred has also worked as an individual consultant and a contractor on several water and sanitation projects. Engineer Wilfred Okero holds a Bachelor's of Engineering degree in Civil and Building Engineering from Chambogo University, a postgraduate training in project planning and management of the Institute, and is a certified of project management in the United Kingdom, and he has a Master's of Science. Allow me to invite Engineer Wilfred to Okero to speak to us. Engineer, you are most welcome.
Thank you very much. I want to take this opportunity to, in a special way, thank Castle Think Tank for considering me to be in this panel and to invite me to be a panelist in this. I want to thank all other panelists. I want to thank the presenter, Catherine, for bringing out very important aspects of WASH in relation to COVID-19. And clearly bringing out several gaps that exist as in the WASH sector, and also opportunities. First and foremost, I'd like to say yes, the findings are correct and very important for the time, the season that we are in. Very important that we discuss this important aspect of WASH and COVID. COVID is claiming lives of very important people in this country, but also across the world. You see that the pandemic is causing a problem. So very important that Castle Think Tank chose this topic, and kudos to you for this. First and foremost, I'd like to say that issues of WASH has majorly been addressing issues of diarrhea. Diarrhea has been the major concern when it comes especially to hygiene and sanitation. But COVID-19 has given us a new challenge. It has introduced a new parameter in the equation, and thus calling for more concerted efforts on how to address, to solve this challenge at hand. And I thank all the panelists for the input already. I'd like to draw your attention to the need for hand washing. Because by hand washing, according to Center for Disease Control, you're able to reduce 30% prevalence of diarrhea or risk of diarrhea. And another 20% for respiratory infections, of which COVID is one of them. But this is coming in so strongly because the respiratory infection that we are dealing with here is lethal. And so when you also look at the priority for water or WASH, water, sanitation, and hygiene, it would follow the acronym itself, with water taking the highest priority and also the highest budget. Sanitation taking the next priority in terms of focus of different NGOs, but also the government itself. And hygiene would be left to the community with only sensitization, and little effort was put in this area. The trend seemed to be changing with the need for this hygiene coming out more strongly. You see that production lines have been changed to address the issue of hygiene, not to produce more water, bottled water and all that, but production lines have been changed to address the issue of hygiene. So this COVID-19 has opened our eyes very widely and with more intent to see that the pandemic is curtailed. Now, I know that Catherine provided several statistics in regard to water supply and sanitation and hygiene. I would like to bring to your attention that the access to safe water in Uganda, actually, according to the sector performance report of 2020, shows that there is a reduction in terms of access by 1%. And this is something that we also need to look at critically, because for you to wash your hands, you need water. Water is at the center of this response to COVID-19, because without water, all these other efforts may not yield the fruits. So when you look at it in terms of the SDG indicator, safely managed water, which is water at premise, this is still very low. Very low in Uganda. In the rural areas, it is still at as low as, actual basic water is still as low as 68% compared to previous financial year, which was 69%. So most of the facilities are shared facilities or public facilities. And these facilities have points that people touch them as they go to fetch. For example, a borehole, you need to be pumping, you need to touch it, and so all these kind of things. So calling for more thinking on how we can use touchless technologies to access water. And yet, when you look at the proportion of technologies that supply water to Ugandans, you find that about, I would say 67% served, 67% of Ugandans are served through either deep boreholes or shallow wells. So which depend on a hand pump, the greatest proportion. So they are touching these facilities. And then protected springs and others also contribute to nearly 20%. Rightly pointed out as an opportunity by Catherine is that rainwater harvesting tanks are not so much used by Ugandans, because according to the sector performance report, 0.4% of Ugandans use rainwater harvesting tanks. Recently, I've been challenged by one of the district chairpersons that instead of developing water, we need to be managing water. Managing means using what is available, according to his explanation, of which rainwater is available, can be trapped before going into the ground. So these are all opportunities that we need to be looking at. But to be more specific, let me, before I go to that, in terms of financing, critical to note that there was an increase in financing to the sector. But very key also to note is that according to the sector performance report, The releases were only 66%, 66.3% of the budgeted funds were released to the sector for use. And now let me go strictly to the opportunities that we have. The very first one, which I see very critical, is also leadership. How do I explain this? The very first one is the will and the power of leaders. It had never occurred to me that the state can have so much power to even shut down a country. How much more would the state, through the same power that they have, send a message to the people and say, by the end of this month or by the end of this year, we want everyone to have electric in their home. And of course, there are all those forces, or I would say structures, that are available to make sure this is implemented. Not necessarily the LDU that were used to enforce some of these restrictions, but it is possible that the state can utilize this power. The second one is the will that I saw very, very strong. How did this will come about? The president of our country believed in science so strongly. You could see all the addresses being made. The Minister for Health was there. And all the communication were based on science. How much more can we harness this kind of will as WASH sector? And we also sit at the table with the president and say, this is something important. The other one, which I would like to bring out, is the priority. If you looked at sectors that were allowed to operate, you could clearly see that those are the important sectors. Those essential services that were allowed, that were set up by the nation. Water was one of them. But this is not accompanied by the resources. There were other essential services that there were other non-essential, okay, I would not say non-essential per se, but there are those that did not make it to the list of essential services, but yet allocated a lot of funds. Big percentage of the budget goes to such sectors. So this COVID has also exposed what are the key, real priorities, and we want to see that these priorities are reflected in the coming years, even when COVID stops. The second one, which I also want to bring, is the aspects of innovation. Of course, we've seen innovation in terms of hand washing, innovation in terms of making of sanitizers, okay? Touchless technologies for hand washing, economical or water-saving hand washing facilities, you know. I'd like to bring us an opportunity here that this innovation should be harnessed, should not stop with COVID. And we need to now engage the next gear with this innovation. How about instituting a law or a guideline for that sake, to say all public buildings should have like a hand washing facility at the entrance, at the gates. I was, when this pandemic came up, I was reminded of a time when I visited tallow oil establishments in the oil region. That was in 2012, way before even COVID came. And one of the entry conditions was to wash hands before you enter the premises. They were not looking at COVID by that time, but it was one of the safety measures. So this is something that we can say, okay, all public facilities by standard should have hand washing facilities installed at the entrance. The other one is to have communal hand washing facilities in key establishments as a guideline or as a measure that we are adopting as a country or as the globe. I want to point out one challenge that whereas a number of attempts were made in production of sanitizers or innovation in hand washing facilities, but I want to think that, okay, I've not carried out a study, but from my observation, there was little effort done in soap making at household level, by different players. Soap making, you still find most people are buying soap from already established factories. The third opportunity that I also see is opportunity for integration. Water, sanitation, and hygiene. Even if we call it wash, there has been some kind of isolation with sanitation being looked at in a different way. Water also is the implementers of water supply are also working in isolation. And then the aspects of hygiene. So there is need for us to integrate this, because we have now seen clearly that for someone to practice hygiene, there is need for water. For someone to practice good sanitation, there is need for hand washing facility. For someone to practice good sanitation, there is need for water. So this is very key. And I think in addition to that integration within the wash sector, there is also need for integration with other sectors. Catherine mentioned the aspects of highway sanitation. As a ministry, we've adopted this. We've piloted some highway sanitation in our projects in Chihura and Lukalo Kabasanda water supply system. We have also some highway sanitation facilities that are being constructed. But I think she clearly pointed out there is need to engage the private sector very strongly to ensure that these aspects of highway sanitation is upscaled. But also through that we are integrating with a Ministry of Works and Transport, because highways is a mandate of Ministry of Works and Transport or the transport sector. How about having communal hand washing facilities in bus parks? Such establishments which collect so many people from different places. We don't know whether, even if you measure the temperature, some, like Shiva pointed out, some people are symptomatic, but having these establishments in those places, transport facilities installed with hand washing containers inside it, like we've seen buses with sanitation facilities, but also now we're saying if we have buses which are fitted with hand washing containers inside it, or with automated hand sanitizer dispenser, before approval by Ministry of Works and Transport, working of course with the other, I would say, entities like KCCA, those are urban authorities, to ensure that even maybe motorcycles have these dispensers. So these are all opportunities that we need to harness as the wash sector. Now, particularly I want to give a comment in regard to the water and environment response to COVID-19.
Yes, Engineer, make that as your summary.
As I conclude, clearly pointed out by the presenter, Catherine, the water sector was not considered was not given funds to respond to COVID-19, but we did not just stop there. We did not look on because we were not given the funds. Most of the funds were going to food and testing and all that. But we were instructed to ensure, one, that there is no disconnection for non-payment of bills. So that one, the water sector made sure all water users are not disconnected or they are not prohibited from using water because they have not paid their bills. The second one was that we were asked to make sure water is stable in all the quarantine centers. And this we heavily did, and in health facilities that are connected to water. So those were priorities that the Water and Environment Ministry made. The other one was that the ministry developed a standard operating procedure for public water facilities, for use of public water facilities. And these were disseminated to different districts to ensure that water facilities adhere to these SOPs. So that SOP was made by the ministry. Then the other one is that priority for repair of non-functional water facilities was loudly given to all the chief administrative officers in a letter dated 31st of March, that chief administrative officers were instructed to prioritize repair of water facilities using the conditional grants that the ministry sends to district local governments. So this, we've seen, districts went straight ahead to repair many boreholes using the grant, and they were allowed to change a few things within the grant for boreholes to be functional. Then the other one was that water was made an essential service. So water continued working throughout the lockdown period, and even when the lockdown has been eased, the water sector has been working very tirelessly. I would like to thank you, all the panelists and all the participants, and I wish you well. Thank you.
Thank you so much, Engineer Okero, for giving us that perspective from the Ministry of Water, Lands and Environment. We are very, very grateful. Thank you so much. Now we are going to receive the next 4 questions, but before we do that, I'd like to request all panelists to check in the Q&A section and respond directly to the participants. They have some questions and comments. You can respond in writing, and later on we'll give an opportunity to even speak to those points. So that would be very grateful. We still request our participants to continue engaging us by sending in more comments and more questions. So now let's have the next 4 questions before we go to our special guest this morning. Just watch over your screen. The 4 questions will be coming soon. Okay, here it comes, and it's about hindrance. What is the biggest hindrance halting the spread of COVID-19 that the government should address urgently? Is it option 1? Is it poverty among the populace? Is it the resistance to recommend behavioral change by communities? Is this the silo approach for managing the pandemic with different players providing emergency interventions in an uncoordinated manner? Or the election campaigns that have resulted in the infection rates spiraling out of control? Please give us your opinion, your best answer to the question. Once again, the question reads, what is the biggest hindrance halting the spread of COVID-19 that the government should address urgently? Remember now, COVID is approaching 20,000 cases here in Uganda. What is the biggest hindrance? Is it poverty among the populace? Is it resistance to recommended behavioral change by communities? Or it is the silo approach to managing the pandemic with different players providing emergency interventions in an uncoordinated manner? Or the election campaigns that have resulted in the infection rates spiraling out of control? Over to you, participants. We want to hear your opinion. We want to get your response. We are going to give it a few more seconds as you respond before we close. Over to you, participants. The question is on your screen. Please, I'd like to see again your your involvement and high participation in these 4 questions. It is the only way we can understand your feeling, to understand your thoughts and your opinions. We will be closing the 4 questions shortly. I hope you are all responding to the question. We will be closing out shortly, and we should be able to see what you have to say in these 4 questions. Okay, can we now have responses? Wow, we have responses with 64% saying resistance to recommended behavior change by communities. And coming second to that is the ongoing election campaigns that have resulted in increasing infection rates at 36%, poverty at 9%, and the silo approach having given 0. This is very, very important for us to observe, and it will guide all stakeholders and policymakers on the next action. And this 4 question comes in at the right moment when we are going to speak to our special guest this morning. So we have closed the 4 question, and we are going now to what we've been waiting for, our special guest for this webinar. And allow me to invite and introduce our special guest, Ms. Julian Chomhanj, the Commissioner Environmental Health, Minister of Health. I'm going to introduce our special guest a little bit more in detail. Ms. Chomhanj is the Commissioner in the Environmental Health Department at the Ministry of Health. She has a vast experience in environmental health practice and leadership at the national level. She has been at the forefront of advocating for improved environmental health in Uganda for many years, and she was instrumental in environmental health becoming a department at the ministry. This department supports all environmental health functions across the country, including policy development such as water, sanitation and hygiene, food hygiene and safety, pollution control, solid and waste management, inspection of premises, and public health regulations. Dear panelists and fellow participants, allow me in a special way to invite our special guest for this webinar, Ms. Julian Chomhanji, to speak to us. Julian, you are most welcome.
Thank you very much. Our dear good moderator, Dr. Lawrence Mugisha. I hope everyone is listening in.
It's Lawrence.
Thank you, participants, for coming up in big numbers. I'm not the one to welcome you, but I can also say welcome to come and listen to what I'm going to deliver. And I'm also happy and privileged to be the special guest. I don't know how special I am. To be talking to an audience and to be part of the think tank, the Castle think tank. In the morning, I was asking David Musoque, what is this Castle? What is it all about? Is it political? Because I'm not a politician. But I'm very privileged to have this opportunity to talk to you all, good listeners. First of all, I would like to appreciate all the panelists, especially Dr. Catherine Kasozi. She was spot on. And actually, I'm not going to prepare anything. I'm just going to talk about or to comment or to appreciate what she has already alluded to, and also the other panelists. First of all, this statement is correct. WASH provides the most effective measure strategy for prevention of COVID-19. When WHO declared this pandemic in January 30th, I think we were all scared, but with God's grace, we have managed to manage it. And as we stand today, I'm going to give a bit of statistics for today. I was on the platform. As of 26 November, we have 473 new cases. We have cumulative confirmed cases, 19,588. We have total deaths, 197, which includes 6 deaths as of today. We have cumulative recoveries, 8,840. We don't have any recovery today, not yet. We have total samples taken from people as a country, 620, 558. And we have the new ones among these, 1,775. Looking at how we are getting increased new cases in the country, it's really worrying. It's worrying because people, as we said, we have gaps, we have challenges, people are not following the standard operating procedures set by government, set by the Ministry of Health. As they have already introduced me, I have experience of over 35 years of service from junior officer to date as a commissioner, head of environmental health department. And I've seen it all. When you look at my colleague from Ministry of Water and Environment, I thought he was going to give us how they are going to increase availability of water in the country. There is no way we can talk of WASH without availability of water. Water is very key. Sanitation and hygiene is health, and we are public health specialists to protect the community not to get infected. That's why in this era of COVID, WASH is very important. And we need to get water which is accessible and affordable. I know in the rural area, water is free, but in the urban areas, water is not free. I expected the discussant, I expected somebody to tell us how they are going to reduce on the costs of the water, because the government invests in water. What is the takeaway in this era of COVID? I know you removed those who had pending bills for not paying, but it's not enough, because according to Catherine, poverty levels are also hindering the prevention of COVID. That means there is a bigger percentage of the population which cannot access water, potable water. So how do we tell them to wash hands? We are talking of massive sensitization. How are we going to sensitize them without providing enough water, without providing water? Recently, there was a documentary briefly shown on one of the outlets, media outlets. Here in Impigi, people were getting very dirty water in a hole, which we used to call a margot at school of hygiene. We used to call those holes where people draw water, which are not protected, margot. And very big numbers were drawing water. Others were washing there, others were bathing there. So they were drawing water in that area. Then also, Catherine alluded to the laws of the country. I would like to make a correction for the benefit of the Castle think tank. NEMA Act is recent. It is National Environment Act of 29. It has been amended to National Environment Act of number 5 of 2019. And I have a copy here. So you can see it. It is 2019, no longer of 2005. That is just a correction. Inadequacy in data correction. That's very correct. Catherine and think tank, you are spot on. We have inadequacies, but the ministry is not sleeping. We are trying to create real data management, and we are going to have coordinates. We have support from Unicef. Thanks to Unicef, they have been our big funders. We are creating a system where you can be in the office, you click, and you see the toilets, you see the facilities in the community. That is real-time data management, and we are investing in that one. Investing being low. If you asked me, what is the budget like in the Ministry of Sanitation and Hygiene or Environmental Health? Thank God we're a department, but still the budget is still low. But we have managed to lobby and mobilize resources and have projects. We have been having a Uganda Sanitation Fund program, which has been running for 9 years. It came into being in 2011, and we are closing it end of December. But we have another one, which is running for 3 years, called WUSHA, Uganda Sanitation for Health Activity, which is a project run by USAID. It is also our baby of environmental health. And we are bringing another one very soon, a Sanitation and Hygiene Fund. All those are efforts to supplement the government budgets, because if you ask me, I think our budget in the ministry is 0.001. But we have to supplement, we have to be innovative, as the text was saying, and bring in more funding for the government. And I alluded to having a WASH strategy. Yes, not for COVID specifically, but we have a strategy which is called Improved Sanitation and Hygiene Strategy, which is used by all sectors, Ministry of Education, Ministry of Water and Environment, and Health, and it is housed by the Ministry of Health. So we have that strategy. When COVID came in the ministry, we don't operate in a normal way. We created pillars. We have case management, coordination. So WASH is a sub pillar under case management. So we have developed guidelines. I think some of you have seen the guidelines for WASH. We have developed, and we have a lawyer. A lawyer helped us to have instruments, a statutory instrument, because the COVID is a new disease on the scene. So we went into Public Health Act of 2000, and Section 28. So we had to have a statutory instrument to run the COVID. Although the fines are still low, our Public Health Act 2000 has been amended, and it is a cabinet memo. We are waiting when they finish elections, and then it's tabled to cabinet, and then we get a new act, a new Public Health Act, which has been amended from the old one, and the fines have been improved. So we will have a way of even punishing the COVID offenders who are not following the SOPs. But we couldn't sit without an instrument to operationalize the COVID SOPs and the COVID guidelines and all those. We had to have an instrument, which we disseminated widely. I think local governments, they received the instrument. Then I'll talk also, I know I have little time, but I'm going to touch everything to make things clear. The memorandum of the MOU, the memorandum of understanding among the 3 ministries. Actually, I have a copy. I will try to circulate. I'll give a copy to the Castle think tank so that they see what the memorandum of understanding was saying. It was drawn 2001. I was present when it was being drafted. We used to have a coordination unit for water and environmental sanitation, which was housed by Ministry of Water. That time, Ministry of Lands and Water, and ministries were in that unit. I was representing Ministry of Health in that unit. There was education, there was gender, and when it came to sector-wide approach, the SWAP, then each ministry went home. Each member of the ministry went back to their respective ministries. That was the MOU. The MOU was just to guide how we can continue implementing water and environmental sanitation. And Sanitation at schools was for Ministry of Education, and rural sanitation for Ministry of Health, and urban sanitation, still it was for Ministry of Water and Environment because of National Water and Sewerage. National Water and Sewerage is a parastatal body and governed by Ministry of Water and Environment. That's why Ministry of Water and Environment is in charge of urban sanitation. But for the whole of sanitation, for the public health interests, Ministry of Health is the mandated ministry. That's why we have our foot soldiers, health inspectors, environmental health officers in local governments take care of that interest. And we are governed by the Public Health Act, the Act of Parliament. So that's the MOU. Then eventually they hired a consultant to improve on the MOU. But the consultant didn't give us good news because the consultant was recommending they add on more ministries. My question was, if it is not being operationalized, it was financing. It was financing because we had a basket funding which remained in one of the ministries. Other ministries never took the funds. So the problem was finances, but the consultant brought on responsibilities, which was not true. I leave now that one because it is not the issue of the day, but I was trying to clarify on the MOU, which has been an issue among civil society organizations, an issue among line ministries, an issue for the government. But we are pushing on, regardless of the failed memorandum of understanding. We are still pushing on. Then we are coming to soaps. I think the polls have said it all. I was watching. You have seen the answers. The answers are geared towards people not taking the soaps seriously, procedures seriously. Water didn't take off water from those who never had, who had bills. Also, we have challenges which Catherine brought out and which are real. Lack of public toilets. Many times when you are traveling, you are forced to stop and seek help from petrol stations. Why can't we have motels? Not motels as such, but something, some stopovers, some places where public toilets are there. We can even pay a fee, but somebody has to where to stop, stretch, and have a snack, and then have a clean toilet. High poverty levels. Of course, we are not going to stop poverty today, but it does not stop you having a toilet. Being poverty stricken, and then you are going in the bush doing open defecation, you're adding more fuel to the fire. I think poverty is not a big excuse because we don't have Ugandans. We don't have communities sleeping under trees. We don't have communities sleeping in trees. Every household has a house and a toilet is a second home. So I think that is not a good excuse that poverty can stop people practicing good behavior. Water pollution is also another issue. And then financing, I have already talked about it. And then resisting communities, the polls have already answered it. And I need also to bring out some of the statistics for the country, especially in the area of WASH. The waterman has alluded to coverage of water. Sanitation, when it comes to basic, Catherine is right. When we go by JMP, Catherine is correct. But when we go by Uganda standards, I think we are far from what Catherine is saying. We have toilets. Ugandans have toilets. Because I know the basic, this joint sector review, which ended last week, we at least around 28% of the basic. Remember, SDGs has safely managed, has basic, has limited, and unlimited. So when you go to basic, you're not talking about even the safely managed. But for us, we are looking at basic, we are 28. That is a good toilet, washable, standard. We go to actual toilets, even those shared, we are at 79.1% latrine coverage. And hand washing, with COVID coming in, we have moved Some districts are in 80s, 70s, 60s, and as a nation, we are at 41.9% hand washing from 36 of last financial year. I don't know why people don't want to wash hands. Even in the presence of COVID, you can see the figures. They are not moving very fast. We are still resisting the soaps. We are still resisting. And as we resist, as the Unicef person said, we are causing more problems than harm because COVID is there and it is real. Because some people have lost relatives. COVID is there and it is real. So as a country, we have moved. Now we need to go back and polish up the 79 point something and then get the basic. But we are on the right track. We are not sleeping. But we have opportunities. We have bought megaphones as a ministry. I'm not going into what people have contributed, but before I conclude, I would appreciate the partners. I cannot go into what they have contributed, but they have contributed enormously. As you have heard from Hajara, many WASH partners have contributed during the time of COVID, and they have contributed and supported the ministry to combat or to prevent COVID-19. We are engaging private sector because these programs that are coming into play are helping us to market sanitation. But you cannot market behavior. Behavior is an individual, is personal. So that one needs a lot of mass sensitization, a lot of talking, and you know behavior change cannot happen overnight. It takes time. Maybe we should now start carrying out CAPS, knowledge, attitude, and practice studies as a CASO think tank. What is the attitude of people? Why aren't people changing? Why are people resisting what the ministry has put in place? Why are people resisting every angle of trying to prevent them getting COVID-19? So we need to look into those. I also commend the think tank for bringing these innovations. Rainwater harvesting. It's a very good thing for the country. It's very good. We need to strengthen. As I talk, I harvest rainwater. I have 11,000 liters of rainwater. And when there is no water, when the national water doesn't pump water, I pump water. So I have flowing water 24 hours. So really, rain harvesting, we should go and invest into that. And communities need to be sensitized. And I remember when I was young at home, we used to have small gutters, and then we would put banana coverings. I don't know what you call it, but banana, not leaves, but the covers of the stem. We share them, and then we collect water and harness. And then research, we applaud the researchers because research informs policy. With policy, you must have data, you must be informed, you must have real data, researched data, so that you can make good policies. So we applaud the people who are doing research and should continue in that area and should be strengthened and funded to do more. And then we go to the teaching. I got to Mr. Musoque's presentation. We need also to enhance our careers. If you have the basic, what interesting topic, you can go for this short course and enhance your career and become an expert in wash. In the hand washing area, the foot operated. We have even the ones which are just using a bottle, the 1 liter in the north. There's an innovation where you don't need to buy a hand washing facility, but you use the 1 liter and modify it and have a hand washing facility. So we need to do more in that area of behavior change as CASO think tank. because that's where the problem is. Even educated ones, we have been in workshops, we have been in conferences, but people leave after doing the business, even after using the toilet. The water is there, but they walk out. So we need to change that mindset and move together. Together, we can do it. When you go to the presentation of Mr. Shiva, he alluded actually to our strategy. The demand, creating demand, the supply chain, that is the marketing and enabling environment. For us as government, I think we have created an enabling environment. We have allowed, we have accommodated all people of all walks, especially civil society organizations. We have appreciated them, academia. You know very well, our minister, as she was going to the president's address to the nation, she had scientists. There is also a pillar for scientists for COVID-19. You are all aware. So we believe in science, we believe in research, and we believe in every possible way which can help us prevent or treat COVID. I don't know how many minutes I have. Moderator, have I exhausted my time?
You can give concluding remarks.
Okay.
You can give 2 minutes and you conclude.
Okay, thank you very much. Thank you very much. Because I wanted to talk about the will. I will. We have political will. We have good leadership exhibited by the ministry, our minister, our state ministers, all the top management. Because every Tuesday, we have a strategic planning meeting. That's when we review how we have performed every week. Every week, we have a leadership strategic planning meeting chaired by the minister. And it is about almost 12 hours. And we sit in that meeting, even up to late as 9 o'clock, discussing things which benefit the whole country, not for ourselves, but for the whole country. So in my conclusion, I think this Castle think tank webinar was timely, and making me the special guest is an honor to me, because to share these things we have done with our partners is very important. But before I end, allow me to appreciate our partners who have contributed. If time could allow, I would even read out what the partners have contributed. But we have many partners. We have WaterAid, they contributed a lot, sanitizers, tanks, hand washing facilities. We have Water for People. Water for People is doing a lot in districts. They have even put water systems, which are costing them billions, to make sure that the people of Uganda access good water. We have AMREF also, they know their contributions was enormous. We have Vision, we have Evident Action. They distributed soap to 11 districts of the eastern part of the country. Every household got a bar of soap from Evidence Action. We have SNV, we have WUSHA, which is running our project, USAID. And lastly, we have the UN, Unicef, which is our biggest funder. Together, we have been in Unicef. We have been with Unicef over years. Since I started working 35 years ago, we have been supported by Unicef up to date. We thank you all so much, dear partners. If you are listening in, thank you so much for supporting Ministry of Health, Environmental Health Department, for supporting WASH causes. God bless you and God give you more. Thank you so much, Dr. Lawrence, for giving me this opportunity with your group, Castle Think Tank. Thank you so much. God bless you.
Thank you so much. Our special guest, Ms. Julian Chomhan, Commissioner for Environmental Health. You have given us an insight of what is happening in the ministry together with other line ministries in the areas of WASH. We are now going to open the discussion to include participants' view, including responding to the questions posted in Q&A, and I'm going to guide this discussion. I will be directing some questions and some comments to a particular panelist who will take a few minutes, 2 to 3 minutes to respond and give back the feedback. I would like to start with you, Commissioner, when your topic is still hot, and address us on the issue of to do with Public Health Act. When I was growing up as a child, we used to have health inspectors, and they would be visiting our homes to ensure that we have sanitation facilities, and working together with the local leaders, they would ensure each household has got those facilities. What went wrong? The act is there. I know it has been updated to the one which is supposed to be approved, but the act has been there for a very long time. What has happened in between? And that same applies to the MOU which was signed and eventually it fell into the limbo. I think we need to address that to help us reflect. Are we still leading? Are we in charge? I would like you, Commissioner, to address to us on that issue, given that we even have a very big network of health network, including village health teams, but we are not implementing hygiene and sanitation measures. Why? Commissioner, you could address that question as we look at others. Thank you so much.
Important, we have the act, although some people have been saying it is archaic, but it is still in force. It is an act of parliament. It was not repealed among the acts which were upgraded to the level of 2000. It is still in force, and we have the public health regulations which are still in force, and we have all the workers. Actually, every sub-county, we have even pushed our health assistants to the parish. The problem is transport. Our health workers are willing to deliver, but they have no transport. You used to see them, but remember they used to have bicycles, they used to be mobile because they had transport. But now imagine a whole sub-county. How do you walk house to house, a whole sub-county without that transport? Funding has started trickling in. There was totally zero facilitation. We know they earn a salary and they are supposed to deliver because the salary makes them deliver. But they have been trying their best. That's why you heard me reporting that we are at 79.1. Where do you think we are getting that data? We are getting it from the mainstream. We are getting it from local governments with our VHTs, through the health assistant, to the health inspector, to the assistant district health officer, who used to be called the DHI, and then it filters to the national level. If they were not there, if they were not working, wouldn't be having 79.1% of latrine coverage. Remember, we have difficult areas. Dr. Catherine alluded to the water table. Actually, it is not a water table. It is hard to reach. It is dry areas like Karamoja. Karamoja, they are still at 4%, 10%, 6% latrine coverage. When you add it to the whole country, then it lowers it to 79. Otherwise, we have districts like this USF project. We have districts which were selected to be declared open defecation free, like Maracha in West Nile, Moyo in West Nile, Oributong in Lira, Bodambuli in Eastern region. And also we have launched National Cleaning Days. We did it scientifically because we were supposed to launch it this year in March, but because of COVID, we couldn't have a big gathering. So we have launched cleaning days. We are requiring every citizen, every Ugandan loving citizen, every last Saturday of the month to come out and do the cleaning of their environment, of their households. That is the issue. I think with that, we don't need even to enforce, because enforcement, they used to call us soldiers, if you remember. But now we want to have a better approach. We want to sensitize, we want to talk, and then enforcement comes for those stubborn ones, those who are resisting to become clean, who are resisting to use a toilet, who are resisting, who are still.
Okay, Commissioner, it seems we have lost you. However, you had given us your response, which is greatly appreciated. When you get back, we will give you an opportunity to continue giving us submission. Allow me at this juncture to invite David to speak a little bit to us again about the enforcement of silos, working in silos.
I wanted to go on MOU, okay, then I come to silos. I'm coming to silos. Okay, the memorandum of understanding. Okay. The memorandum of understanding, we have really worked. We formed a subsector called the National Sanitation Working Group, which is a pressure group out of government, out of the bigger sectors, because we know sanitation and hygiene were marginalized. They were a silent issue. It was an orphan. So we became out with a subsector of a working group, which has done a lot of things. We even created a specific budget line for sanitation and hygiene in the Ministry of Finance. But sector ministries have not put money, except Ministry of Water and Environment. They put money which goes as a grant to the local government. Ministry of Health puts money under PHC, but we want them to put it in that budget line of sanitation and hygiene, so that we have a specific grant for sanitation and hygiene if we are to fight. Now, memorandum of understanding was saying each sector should budget for its work. That's where the problem came. And yet we used to have a basket funding which remained with one ministry. So ministries have been reluctant. But I said, now under primary health care grant, we are giving 30% for prevention, for promotion and prevention. And we are saying this fund will go to the health inspectors, to the community development people, to the health assistants, to the people who are really sensitizing and mobilizing the community. That is the fate of the memorandum of understanding. Sectors have failed to budget specifically for sanitation and hygiene, because when money comes from finance, it doesn't identify that you budget for sanitation, you budget for this, it is not ring-fenced, it comes for the sector, and the sector sets priorities. So for the Ministry of Health, they are saying, our priority in sanitation, in prevention, we are putting 30% of the Ministry of Health budget. And they have a shift, a policy shift. We have a policy shift. We are moving to prevention rather than curative. That is what I can say right now. Now working in silos. Who starts working in silos? We are not working in silos. We are involving everyone. But we have a strong coordination mechanism. Okay. That is the sanitation working group. We, as the Environmental Health Department, we have a coordination mechanism. That's where we sit together every 2 months and do a roll call. You civil society, what are you doing in sanitation and hygiene? You NGO, what are you doing in sanitation and hygiene? Me, I don't know working in silos. Me, I work in a transparent manner and in integrated manner. For the silos, I don't understand silos. Me, I work in a transparent manner. That's what I can comment.
Okay, thank you so much, Commissioner. We'll have an opportunity for you to make more comments when we are concluding.
I'm still available?
No problem, Commissioner. We are still with you. We end at midday. We will give you another opportunity to make some comments as we conclude. For now, let me welcome David Musoque to give more insight about the resistance in terms of behavior and attitudes from community members, especially having talked about training and research. Is it a wrong approach? Because I feel this needs to start at a very, very low level, if possible at nursery level. There used to be what is called the public health, primary health care that was taught in schools. What has gone wrong? Some of those traits and insights must be corrected early in life, from home to schools very early in life. Waiting up to university level, people do it for academic reasons, not for the practice. David, what is your comment on that?
Thank you very much, Dr. Lawrence. I totally agree with you. The issue of behavior change is one that is a monster, and I think we need, as all stakeholders, to really see how we address this. I also agree that at university level, again, we can only do so much, and therefore a lot has to be done much earlier, and that also brings in the Ministry of Education and Sports in terms of how much they can inculcate these principles and behaviors into children early on in their training. Because when we receive students at the university, although we train some of these things as part of the curricula, if somebody hasn't been brought up with that culture of observing some of these basic hygiene principles, we cannot achieve that much. But one thing that we have done as a university to emphasize the issue of working together is really to emphasize the need to work in various disciplines. And many of you would know the One Health approach, whereby even in our training, we try to ensure that the students appreciate that in this day and age, no single profession can achieve that much on its own. And that's why we try to bring on board the idea of teams working together. So for example, we bring together students who are studying health with those studying clinical disciplines, to those studying environment, to those studying agriculture, those studying social sciences, so that the students appreciate, even from the training, that the field they are going into is not one that they can survive as a single sole discipline, but one that requires different disciplines to work together. And I believe when such professionals reach at the higher levels, as we heard from the commissioner, in terms of national level planning and national level practice, we hope that they will appreciate more the importance of working together, as opposed to looking at their disciplines as the ones that can solve it all. So this is indeed critical, and something we need to think about as stakeholders all around.
Okay, thank you so much, David. Now to Engineer Wilfred Okero. It came out very clearly that water coverage is still very low. Access and affordability is still a problem. You are from the ministry. During COVID-19, you tried to put aside the bills, but I know those people will still have to pay after COVID. We have also mentioned about poverty that is everywhere, and most people cannot actually afford water bills. What do you think needs to be done to ensure there is a water accessibility and affordability for all Ugandans? We want a practical approach towards that direction. You just shared a few insights. It may not be today, but we have Vision 2040. Probably by 2040, we could be there. Thank you so much, Engineer.
Thank you very much, Lawrence, for this observation. As I make this response, please note that access varies from 32% in Chegwegwa to 95%. And there are 17 districts whose access figures are below 50%. So it is true that coverage is still very low. And there's effort to ensure that access is increased, looking at the horizon of 2030, that no one is left behind. The biggest challenge has been financing. So this is also an opportunity for us to advocate. Like I said, the priority came out very clearly. We need to use this platform, which COVID has provided, to advocate for more financing to the sector so that even the districts which have very low coverage, like 32%, like Chegegwa, can have 100%. And we have service improved to safely manage water supply. So that is one challenge that we have as a sector, financing. The other one, of course, you talked about the affordability of water services. True that, yes, there's been some attempt by Parliament to discuss this for bills to be waived off. There was also an attempt to advocate for removal of VAT on water. This has not yet materialized, but we have an opportunity to advocate again and again with all other wash sector stakeholders to see to it that government gives attention, due attention to water supply. The other one that I would like to also bring out is the fact that water, as compared to other social services, is paid for. You don't see people directly paying for roads, except maybe for the road that was constructed going to that express highway. The government said that they're going to be paying for the road toll, but up to now, no one is paying for that. But yet water is a constant, it has to be paid for. Even water in rural areas, communities pay for water. You'll agree with me that people collect, those water user committees collect money from the water users, and they hire a local hand pump mechanic to always fix the boreholes or the springs and all that. So water is paid at all levels. Recently, we published a framework, the O&M framework for rural water infrastructures, that actually provides that all users should pay for water. So it's until when someone pays for that, because we have to meet the cost anyhow for providing the service. And that money is not available with us. So we've had an approach of community-based maintenance system for rural water infrastructure. But for piped water, we've worked with the public utility, who have to meet their cost of operations. They have to meet their cost of chemicals. They have to meet their cost of paying for their staff. They have to meet the cost of repairs to make sure water is available. So the investment cost is usually provided to us, but the maintenance costs or the maintenance funds have to come from the sales of water, from the water user themselves. So this is also in line with water being as economic good, but yes, it's also a social good. So that aspect of affordability, I would like also to bring on board. Affordability, vis-a-vis ability to pay. Ugandans are, water is very affordable. Very affordable.
Yes, thank you so much.
In comparison to other services. Thank you.
Okay, thank you so much, Engineer. As you mentioned that, you'll have another opportunity as we conclude to make a comment. But you remember, Uganda is well endowed with water resources everywhere, God-given, but we have to pay. Even if you say it is affordable, it should have been a public good and a public service. But you have, as you could make your concluding remarks, you'll have to make a comment on that. Let me now invite Shiva to share with us his experience. He has observed very rightly that messaging and communication using all channels should be the most important strategy in order to increase awareness about WASH and adoption. But currently, it's not being done. Shiva, with your experience working with several different countries, what do you think the government of Uganda needs to do in order to improve communication and messaging for this important component? And at the same time, how do we tap from what I refer as indigenous technical knowledge from the local people, that they have the knowledge, they have things they do that can help them to improve sanitation, but we are not paying attention. Shiva, your comments. Thank you so much.
Thank you for this supplementary question. Let me, on the communication aspect first. I think the experiences have shown that to be effective communication, as you said, we have to use multiple channels. But one of the most effective way, what has been seen, is the interpersonal communication is the most effective communication. But then that has to be backed up by reinforcement by the other public channels. And in that way, if we can translate, look at what opportunities we have got in the country. I see our forum for the VHTs, village health teams, which are there in every village that we have. So that's one forum. I think how we can capitalize upon that forum, and especially in the COVID context, I would like to repeat again, is saving your lives, saving your neighbors' lives, and that gives an also a positive image. I know village health teams are not paid, but this is where this whole voluntarism and care for the society, care for your own people comes into play. So that is how we have to place this kind of, I would say, communication aspects of it. The second aspect I would say is the use of again the mass media. Of course, the one they are being used, but also their mass media has got many facets as well. And especially we know that radios have much more outreach than still the television. How effective we can use those channels, and how we can further reinforce with a mix of I would not say bring in the reality, not creating a panic, but making people aware that yes, there is a high risk, and we are not risking ourselves, but we are risking others also. So that brings a community pressure as well, what we call in terms of creating some kind of a social norm. When you go out, at least these two practices must be adhered to. So that I would say the second aspect. Third forum I would also like to highlight, now that schools have opened, and I'm saying practically how we can go, it's important that schools are used for these communication aspects as well. Number one, that will reduce the risk among the children, knowing the fact that generally whatever evidence that has come so far, they are less vulnerable, but also they can be kind of a used as a channel, and that messages go out. So these are I would say the key critical things, at least what we can do without, I would say, not so much external resources or I would say financial resources, because these forums are there. It's a question of reaching out to them. The second aspect you asked about the local practices and knowledge. I think it was already shared. One, the TP tap, the most effective way. TP tap, and as again is based on my experiences. People know TP tap is not only is a good way, but also it is effective way of water kind of a efficiency. You use less water for maximum more number of hand washing, I would say practices. Because otherwise, if you use like normal, you have the other utensils that you use, and the use a TP tap, it is use less water. So that's, I think, is a very good practice that is already there. And as a part of, as our Madam Commissioner mentioned, this is part of the sanitation, open defecation free, kind of a initiative, and it is included into that. But how that can be further expanded to that? So that I would say is one local good practice. That's something we need to build upon that, and that will really help to ensure these hand washing are imbibed into that. Just to conclude, I still feel the availability of these products at an affordable cost, at village level, at the far-flung villages. When we are talking about it, we should think of a household deep in villages in Karenga districts or somewhere up there where the outreach is low. So that we have to keep in mind. And I think with this all combined effort that is going on, it's a question of just enhancing that. And I'm sure that we will be able to make a tangible difference and a lasting difference. Thank you.
Okay, thank you so much, Shiva. We are coming close to the end of this webinar. At this point, I would like to invite Hajara to make a comment and your last word as we conclude. Hajara, you talked of missed opportunities, where during this COVID, we are focused so much on emergency response and missed opportunities provided by different stakeholders, including private sector, NGOs, and others in terms of galvanizing our efforts on WASH. What would you advise the government, the line ministries to do in order to tap into this missed opportunity? COVID is still with us for some time. Hajara, make a comment on that and your last word for this webinar. Thank you so much, Hajara.
Thank you very much. Thank you everyone who has participated and given in their input. My advice is not going to government. My advice is going to everyone that has opportunity to access funding. That includes us, the NGOs, and everyone else who can advocate for funding. COVID is still with us and we are still writing proposals to get funding to respond to COVID. It's high time we start telling our development partners and the funders that in as much as they give us money to respond to the emergency, which is very critical, we need to balance funding to respond to emergency and development. But also key thing is we cannot let things pass and respond without doing informative research. Because when we balance the three, emergency, development, and research, then we shall gather the evidence that shall need also to respond to any other future pandemic like COVID. My last word is that I know we all see COVID as a threat now, but we need not to underestimate the opportunity that WASH brings to not only responding to COVID, but preventing other water, sanitation, and hygiene-related diseases. So this is our chance to ride on what all funders want to respond to, which is COVID, because it's a pandemic, but it's our chance to utilize what we have to show also the ministries and the government that, look, it's high time you invest in WASH because your investment this time contributed to such amounts of disease reduction, and that can only be done when we have informative research. Thank you.
Okay, thank you so much, Hajara. And now to Catherine, I know you are the CP's presenter, but towards the end of your presentation, you talked of the gaps, and one of the gaps was waste disposal, which is very, very bad in this country, and it contributes to a lot of infectious diseases, even sustaining COVID-19 within the environment. What would you advise us to do, or advise anyone involved in waste management to do as we respond to this comment? Please also make your concluding statement because we are coming to the end of the webinar. Yes, Catherine.
Thank you very much, Dr. Lawrence. I'm privileged that you've asked that question. I feel strongly that more than ever before, what is really crucial is for us to have joint collaboration. All solutions can be dealt with, but if we have a joint collaboration, and I wish to bring this to Engineer Wilfred and Ms. Julian Chomhanji, that we need to sit on the same table with everyone, with representatives. What Hajira has said cannot be downplayed. The fact that we need to work together to find informative information, then we can tackle every area, every problem. And I feel strongly about waste management because with waste, we're dealing with a time bomb. And if we don't look at it holistically, I'm praying that we will engage together as CASO and all these sectoral players to be on the tables of strategic planning, because I think that we have an opportunity, we have a chance to now work together more than ever before. If the private sector is doing it, we need to be doing it as collectively as possible. So my parting shot is to say Thank you for giving me this opportunity. Thank you, our panelists, for bringing a lot of information that we can now deal with. As we go back as CASTO, we need to go back to the drawing board and correctively see. One of the things that I've seen, as Engineer Wilfred shared, is that we see parallel sources of data. It would be very good if together, as we find solutions, we are also collectively finding data and uniform data that helps us to make decisions as a nation to transform the apathy of WASH in our country. Thank you.
Thank you so much, Catherine. David, you are cutting short. You are just concluding statement.
Thank you very much, Dr. Lawrence, and thank you very much, Castle, for the invitation. And I've really been privileged to take part in this, and also thanks to the fellow panelists. It was quite engaging and very useful insights. My final words are that, as we have all seen, this issue of WASH in COVID, but also beyond, is not a one person or one sector issue. I think we all have to play a role. And just to emphasize that, for me, I think the key thing is everyone in their own capacity playing their role as they should. So for us who are in teaching and research, we should do that role properly. Those who are into practice should also do their best. Those in the policy formulation, those in different ministries, but also those who are at the forefront of responding to the pandemic should really play a critical role to ensure that each one makes a contribution, but more importantly, working together for us to achieve a concerted achievement, which will, of course, see that WASH in the COVID times, but also beyond, is sustained, and that we can stay healthy with fewer diseases amongst us. Thank you very much.
Okay, thank you so much, David. Engineer Wilfred Okero. Wilfred, please, your last statement.
Thank you very much to everyone who participated in this webinar. As I conclude, as a parting shot, I want to say that water is not only a necessity during this COVID scourge. Water is vital for sustaining life. It's central to any emergency and any development program. So there is need for multi-dimensional approach to ensure that water is available to everyone sustainably without leaving anyone behind. And I would like to call upon you in your different capacities to be the ambassadors to ensure that this vital WASH is available to all in your respective capacity as private sector, as academia, as civil society organization. Will be, as the government, will be at the lead, but we need all these players to ensure that everyone is served. Thank you very much.
Thank you so much, Engineer. And now lastly to our special guest, Ms. Julian Chomhanj, your last words to us. Thank you so much, Commissioner.
Thank you, moderator, and thank you all. My last words are that we need to communicate, and we need to communicate sincerely and properly, so that our messages are the community. We need to policy formulation. We need funding, and we need to utilize maximally the funds we have and get value for money, because money will never be enough. We need commitment because everyone is responsible, and WASH is everybody's business, not an individual, but all of us, we have a stake in improving WASH. Together, we need to work together. We need to stop working in silos, and together we can make a difference. On waste management, we have been moving in cities. I'm a director, I'm a member of the board of directors, NEMA. We have been moving in the newly created cities. They are all choking with garbage. So we need physical planning, proper planning, so that we can be able to manage our waste properly. We need to involve the private sector. They have a key role to play, especially in many areas to make a difference in people's lives. Thank you very much for making me a special guest in this conversation.
Okay, thank you thank you.
And I hope talking and thank you so much.
Okay, thank you so much, our commissioner. Okay, thank you so much, our commissioner. Now we are coming toward the end of our webinar. We are going to have one last poll question, and then we'll be inviting the member of the Council Board to give concluding remarks and closing prayer. Let's have the last poll question. I'm waiting for the poll question. If not, as I wait, in a special way, let me thank our special guest for availing time to be with us this morning, and all our panelists for the good and excellent presentations we have had with us today. And I hope all the lessons will be captured at different level. But as CASO, we are going to have an integrated document that has got all these comments, and it will be shared for further action. We are open to more discussion. Please feel free to share with us, especially the commissioner, share with us the MOU and other relevant documents, and at appropriate time, we will be sharing the synthesized documents. But again, for more information, you can go to CASO website. Most of the documents are already shared on our CASO website. I'm not seeing the poll question, so let me take this opportunity. Once again, thank you so much for participating in this moderation. Our participants, thank you so much for responding, for participating via Q&A. I remain your moderator, Dr. Lawrence Mugisha. I now take this opportunity to invite the Council Board member, Dr. Magara, to come and give us the concluding remarks and a closing prayer. Thank you so much. Over to you, Dr. Magara.
Thank you, Lawrence. And I'd like to very much thank our guests this morning. Very special thanks, Madam Julian Chomhanji. Thank you for making the time to be with us and gracing us with your presence. Thank you, Dr. Lawrence, for moderating. Catherine, thank you very much for preparing and presenting the think piece. Thank you, Madam Hajra Mukasa. Thank you. It's been a very educative morning, and thank you for all the ideas that you bring. Dr. David Musoque, Engineer Wilfred Okero, and Mr. Shiva Narayan Singh. We really appreciate you sparing your morning time to be here. We've learned a lot. We've taken note. I'd also like to recognize the attendees, by the way, the participants. Thank you for being present and engaging in the Q&A as well. As has already been said, the ideas that come out of here do not end here. This is webinar number 27. We've gone through 27 topics. We just have two more. We have international relations next Saturday. You're welcome to join us. We also have the Vision 2040 in light of COVID-19, the week after that. And then on the 19th of December, we shall have a close. So you're still welcome to join us in this morning discussions and conversations. And when we do knock on your door, it's sometime next year to follow through on the next steps. We do hope the doors will still open. And very much appreciated being part of this webinar this morning. We'll have a word of prayer. We thank you, Lord, for the ideas, the thoughts that have come through this morning. And we now pray that you help us to take it beyond words and formulate action steps and actually bring them to come to pass so that we can have a better environment, healthier population, and make good use of all the many assets you've given us, especially in water in our country. We pray you bless the weekend and enable us to find rest before we begin another week. In Jesus' name we pray, amen. Thank you very much. Have a great weekend. And direct your students, direct other people who missed to the website, to the Facebook page. This whole thing is available in its entirety. And you can also watch any of the previous ones if you're interested in the topics. Have a great weekend. Bye.